Hi, Claire. I hope you're having a great day. In our supervision session today, I'd like to bring forward a case involving a 26-year-old male named Sam, presenting with symptoms consistent with both social anxiety and possible cognitive difficulties. These challenges appear to be impacting both his occupational and his social confidence. He's currently unemployed and does report significant anxiety around job interviews, and just task focus as well, general task focus. Socially, he has a good group of friends, but does find himself overthinking and fearing judgment. My long-term goal is to reduce Sam's social anxiety by addressing concerns related to negative evaluation, specifically in social and employment related situations. However, the focus for the next session will be to develop a graded fear hierarchy using the subjective unit of distress scale, or SUDS, and to model an arousal reduction technique. And the modality that I've chosen specifically for Sam is cognitive behavioral therapy. Now, the reason that I have selected CBT as the primary intervention is because, firstly, it's grounded in the generic cognitive model, which is an extension of Beck's original cognitive theory, which does explain how psychological distress arises from four interacting processes. And we can actually see that in some of the situations outlined in the case, where you've got, for example, number one, the situation like Sam attending a social event, a biased belief. So, for example, the fear of being judged for being behind in life that Sam has mentioned. Attentional focus, which is where he worries he will say the wrong thing, and then four, the maladaptive behavior, such as avoiding showing his true self. So the clear correspondence between Sam's presentation and the core components of this model reinforce the clinical relevance of actually using CBT in the first place. Secondly, there's also robust empirical support for CBT in treating social anxiety disorder, with meta-analyses of randomized control trials considered the gold standard for clinical research, consistently demonstrates its effectiveness in reducing social anxiety symptoms. Additionally, a core feature of Sam's social anxiety is his fear of negative evaluation. We see this in how worried he is about being judged, whether it's being perceived as forgetful by his employer, feeling like he may say the wrong thing in social situations, those sorts of things. And due to Sam's anxiety pervading his professional and social life, CBT is particularly justified. Research demonstrates its strong outcomes for reducing the fear of negative evaluation in both interpersonal and occupational settings, especially when it comes to self-related judgment biases, which is closely tied to Sam's presentation. Okay, so there are going to be a number of factors that I need to be considerate of in terms of the client and in terms of myself. So, firstly, Sam's difficulties applying for jobs and feeling overwhelmed by work demands, alongside his tendency to avoid social situations, does suggest that he's dealing with reduced self-efficacy. Now, this could make it tough for Sam to confidently engage in tasks that trigger anxiety or require sustained effort. And for this reason, encouraging early engagement with homework gives him manageable opportunities to gather small wins and gradually boost his self-efficacy. Secondly, his heightened arousal. So it's also clear that Sam experiences elevated physiological arousal in social settings, which is a core component of social anxiety. Now, his fear of showing his true self due to concerns about being judged may carry into our first session, possibly presenting as him being inhibited, fidgeting, and even just general restlessness. And to help regulate this, I'll introduce a brief arousal reduction technique. In this case, I'm thinking diaphragmatic breathing to support him in session and give him a tool he can continue to use outside of sessions. Now, this can enable him to begin to both apply psychoeducation that we do cover in the session, and it gives him a way to begin attempting to break that anxiety cycle when it does occur in real life. Now, in terms of factors that I myself need to be considerate of, firstly, it will be about fostering a safe therapeutic space. So it is crucial, that I create a safe and supportive therapeutic space for Sam. This is because Sam has a history of not opening up to his family when anxious and does tend to avoid showing his true self in front of peers. To mitigate this factor, by demonstrating empathy and a judgmental tone early on throughout sessions, I can start to challenge Sam's assumptions that he will be judged. This is something that research consistently demonstrates, whereby empathy plays a pivotal role in producing greater CBT outcomes by strengthening trust through the therapeutic alliance. Something else that I need to be considerate of as well is how Sam's anxiety shows up across different areas of his life where I may feel tempted to shift between multiple of his challenges at once, risking him feeling overwhelmed and ungrounded. And in this case, his social challenges and his occupational challenges. Now, to prevent that, I'll use the subjective units of distress scale to help us both collectively identify and prioritize the thoughts or situations that cause Sam the most distress. That way, we can approach his challenges in a manageable way, which does, excuse me, which does support his engagement. Now, in terms of the step-by-step plan that I've formulated, I want to make note that it has been planned and supported by a social anxiety CBT manual. And firstly, what I want to cover in the session, or firstly, what I want to do is build rapport for about the first 10 minutes. So this will involve me beginning the session with a warm, client-centered approach by asking how Sam is, how he's been doing, and just inviting him to share any of his recent experiences. Okay, then collaboratively set the agenda by simply outlining the session structure and to invite Sam to offer suggestions or ask questions to support the therapeutic alliance. Secondly, for the next 10 minutes, it's to educate Sam on a simple ABC model to help him understand how his anxiety specifically manifests. Now, to enhance engagement, Sam and I will collaboratively, use a specific life situation to identify first the activating event. So, for example, him walking into a social event, a belief he holds, such as I'm worried I won't have anything interesting to say, followed by a consequence that could occur, such as a physiological or behavioral response. Explaining a simple model like ABC can assist in igniting his motivation and begin to encourage change, even if it's only small. Next, Sam and I will collaboratively use SUDS to co-create a fear hierarchy, supporting a graded approach to his treatment. And I'm thinking this is going to run for roughly 10 minutes. This will clarify which specific situations evoke the most anxiety, guiding both the direction of future therapy and the specific scenario chosen to model and actually practice the arousal reduction technique. While SUDS is primarily used to determine a rating to one's experience before and after exposure to the anxiety-provoking stimuli, literature also highlights its value as a complementary tool to plan treatment as well. So, specifically, it can support the collaborative formation of fear hierarchies and ensure that clinicians, such as myself, are targeting the client's most distressing concerns. Next, I want to run through an arousal reduction technique. So following the creation of SUDS, or the fear hierarchy, I will collaboratively select a moderately anxiety-provoking scenario and model a diaphragmatic breathing technique to support arousal reduction. Now, this will involve guiding Sam to sit upright with one hand on his chest, one on his stomach, breathing in slowly through his nose, ensuring that he's breathing through his diaphragm, exhaling gently through his mouth for 6 seconds while he imagines the selected anxiety-inducing scenario. The current literature does highlight the statistical significance observed in the relationship between the application of diaphragmatic breathing and lower reported levels of anxiety recorded on Beck's anxiety inventory. This will ultimately help my client become more familiar with bursts of anxiety symptoms in real life situations and feel more prepared when they do arise. And then finally, I want to go through homework for the next and final 5 to 10 minutes. So Sam will be given a worksheet from the Managing Social Anxiety Therapist Guide to complete before our next session. He will select a mildly anxiety-provoking event, for example, saying something that he might fear could offend his friends. Record the situation and pre-exposure SUDS rating, so whether it's 0 to 100. Apply the diaphragmatic technique during the event and then record a post-exposure distress rating using the SUD scale. This will help him apply the technique in a real-world context and help track his progress over time. And research again has demonstrated that early homework engagement with CBT does correspond with lower fears of negative evaluation in individual and group settings, an issue again central to Sam's presentation. After all that, I would love to get a bit of your feedback. Let me know what you think, and I appreciate your time today.